Did you know there is a specific time of day when your heart is most vulnerable? It is not when you are stressed, not when you are out walking, and not even when you are lifting something heavy. It is right after you wake up, between 6 and 10 in the morning. Heart attacks and strokes skyrocket, especially in people over 60. And it is not because you are getting older. It is because of how we wake up. Picture this. Your body has been motionless for 7 or 8 hours. Your blood is thicker. Your vessels are tight. Your heart is beating slow. And suddenly you stand up. That one moment creates a surge, a demand your cardiovascular system may not be ready for. But what if I told you that you could fix that risk without medication, without going to the gym, and without even getting out of bed? Before we get started, drop your name and where you are watching from in the comments. We would love to hear from you. Your body in the morning is a hidden risk no one talks about. Imagine your body like an old car sitting outside on a freezing January morning. The engine is cold, the oil is thick, the hoses are stiff. Now imagine turning the key and flooring the gas pedal. The engine chokes, struggles, and maybe breaks. That is exactly what happens to millions of people over 60 every morning inside their own bodies. You see, during sleep your body slows everything down to rest and repair. Your heart rate drops, your blood pressure lowers, your circulation slows to a crawl, your blood becomes slightly thicker, more like syrup than water. For 7 to 8 hours, your body is horizontal. Gravity pulls fluid into your lower body. Your arteries do not move. Your lymph fluid does not flow. And your nervous system is in rest mode. Calm, slow, still. But the second your alarm rings and you sit up fast, you are asking your heart to go from 0 to 60 in 5 seconds. You are demanding it to push thick, sluggish blood through tight, cold arteries and all the way to your brain while your balance, oxygen levels, and coordination are still half asleep. That sudden demand creates a dangerous spike in blood pressure and heart workload, a spike that can lead to dizziness, false strokes, or even heart attacks. And here is the shocking part. This is not about age. It is about physics. You do not need to be sick to be vulnerable. You just need to get up too fast, too soon. But what if you could change all of that? What if in just 3 to 4 minutes each morning, you could gently wake your circulation, soften your arteries, and tell your heart it is okay. We are ready now. You do not need pills. You do not need fancy machines. You just need 3 simple movements that you can do under your covers on your schedule in your home. Movements based on real science used in hospitals, therapy centers, and rehab clinics around the world, and now simplified for you. And once you learn them, they might just become your favorite part of the day. Aging is not the problem, ignoring it is. Let us be clear about one thing. Getting older does not mean getting weaker. Losing strength, balance, or energy is not because that is just what happens with age. It is because nobody ever taught us how to age well. We prepare for careers, for parenting, for retirement. But aging, we are told to just walk more, sit less, and take it easy. That is not a strategy. That is surrender. The truth is, your body still listens. Your blood vessels can still become more elastic. Your muscles can still fire faster. Your balance can still improve. And your heart can still become more efficient at any age. But only if you train it to. And no, that does not mean lifting weights or doing aerobics at 6 in the morning. It means knowing the right things to do at the right time in the right order. That is what this 3-movement ritual is all about. A proven morning system trusted by physical therapists, cardiac rehab teams, and seniors around the world, designed to wake your circulatory system gently and safely. You are not here to reverse time. You are here to take control of it. Now, let me show you how. Movement 1 is the morning embrace, unlocking your hips, the traffic jam of your body. Before you even think about getting out of bed, there is one area of your body that desperately needs your attention. Your hips. Your hips are more than just joints. They are the central intersection for your blood vessels, lymph flow, nerves, and posture. Every night while you sleep, your pelvis becomes a bottleneck. Your femoral artery and vein, major highways for blood flow, get compressed. your lymph nodes slow down, your lower back tightens. That is why so many people wake up feeling like their legs are made of concrete, or why their lower back aches for the first 30 minutes of the day. It is not arthritis. It is not just age. It is congestion. And the way to clear that traffic jam is a movement we call the morning embrace. Here is how to do it. The morning embrace is gentle, safe, and 100% bed-friendly. Lie on your back in bed. Remove thick pillows. Your spine should be in a straight, relaxed position. Slowly slide your right heel up toward your body, bending the knee. Bring your right knee toward your chest as far as is comfortable. Wrap your hands behind your thigh, not over the knee. This protects your joints. Gently hug your leg toward your chest. No bouncing, just a calm stretch. Breathe deeply in through your nose for 4 seconds, out through your mouth for 6. Hold for 10 to 15 seconds, then release slowly, sliding the heel back down. Repeat on the other leg. Do 2 to 3 rounds per side. As you release, notice the warmth. That is fresh oxygen-rich blood flushing the joint and tissues. You are literally washing out the stiffness of the night. David is 79 and said he felt 20 pounds lighter. David, a retired teacher in Arizona, used to dread mornings. He said his legs felt dead until about 11 in the morning, and walking to the kitchen was exhausting. His doctor gave him pain meds. His therapist gave him stretches. Nothing stuck. Then he tried this one movement for 1 week. On day 6, he told me he got out of bed and it felt like someone had drained the cement out of his legs. He walked to the kitchen with no cane, no wobble. This is not magic. It is mechanics, and your body is begging you to do it. Why it works is because it improves blood return from the lower body. It releases tension in lower back and hips. It massages your gut and lymph system. It wakes up muscles before loading them with body weight. This is your foundation. Without unlocking your hips, the rest of your body cannot function freely. Movement 2 is the air circuit. Switching on your second heart. Let me ask you a strange question. What organ helps pump your blood but is not part of your heart? The answer is your calves. Most people do not realize this, but the muscles in your lower legs, your calves and soles, are often called your second heart. Why? Because they are responsible for pushing blood back up from your feet to your heart against gravity. Every step you take is like a mini pump squeezing veins, sending blood upward. But here is the problem. At night, you do not walk. Your calves do not contract. Blood pools in your feet, fluid builds up, and circulation slows to a crawl. This is why so many people wake up with swollen ankles, cold toes, leg cramps at 3 in the morning. If your second heart does not turn on in the morning, you are starting the day already behind. Here is how to do the air circuit. Stay lying down in bed, legs stretched out. Begin with simple ankle pumps. Pull your toes up towards your face, then point them away like a ballet dancer. Repeat this 30 times in a smooth rhythm. Up, down, up, down. Feel the tightening in your calves. That is your second heart turning on. Optional for extra energy. Lift your legs slightly and pedal slowly in the air like a lazy bicycle. 10 to 15 seconds is enough. Then pause. Let your legs rest. You may feel a pleasant tingling. That circulation coming back to life. Evelyn is 68. For the first time in 10 years she did not wear socks to bed. Evelyn always had cold feet. Even in May, she wore wool socks to sleep. After 2 weeks of doing the air circuit every morning and evening, she messaged us saying for the first time in 10 years her toes felt warm without socks. Why it works is because it activates the calf pump, which boosts venous return. It reduces fluid retention and swelling. It helps prevent nighttime cramps and blood clots. It improves oxygen delivery to your legs and brain. This is not exercise. It is waking up your internal plumbing. You have now unlocked your hips and turned on your calf pump. There is just one step left, and it is the one most people skip. Movement 3 is the ocean breath. Your built-in blood pressure medicine. By now, your hips are free, your calves are pumping, blood is flowing, but there is one last piece of the puzzle we need to unlock, and it is the most powerful of all. It is not a stretch, it is not a movement, it is your breath. You see, right before you wake up, your body releases a natural surge of cortisol, the stress hormone. It is designed to help you feel alert, but in many older adults, this spike can cause a sudden rise in blood pressure and a feeling of anxiety, dizziness or mental fog. That is where your nervous system comes in. There is a special nerve, the vagus nerve, that acts like a remote control for your heart, lungs, and blood vessels, and the only way to activate it is through slow, controlled belly breathing. We call this movement the ocean breath because when you do it right, it feels like a wave washing through your body. Here is how to do it. Lie on your back, one hand on your chest, one hand on your belly. Inhale through your nose for a count of 4 seconds. Your belly, not your chest, should rise. Pause for 2 seconds. Exhale slowly through pursed lips like blowing on a candle for 6 to 7 seconds. Repeat for 5 to 6 breaths. As you breathe out, feel your body sink deeper into the mattress. Your shoulders drop. Your pulse slows. Your arteries open like soft rubber hoses. You have just told your heart there is no emergency. We are safe. We are ready. Stan is 71. He said his mornings used to start with panic. Stan used to wake up already thinking about the news, his finances, the world. His blood pressure was sky high by 7 in the morning. After practicing the ocean breath for 3 weeks, his doctor said his numbers were better than they had been in 10 years and asked what changed. Stan smiled and answered, "Just breathing." Putting it all together is 3 minutes that change everything. You have just learned something powerful. Not a workout, not routine, but a morning ritual that speaks the language your body understands. First, you unlocked your hips, clearing the bottleneck that blocks blood flow. Then, you activated your calves, turning on your second heart. And finally, you calmed your vessels and brain with nothing more than your breath. Together, these 3 movements form a complete system. They reduce your morning blood pressure spikes. They wake up your nervous system gently. They protect your brain, heart, and balance, all in just 3 to 4 minutes without ever leaving your bed. And here is the beautiful part. You do not need motivation. You do not need energy. You just need to remember to begin. Because once you do this for 3 days, 7 days, 21 days, it stops being a task. It becomes a habit, a comforting, energizing start to your day. Like warm sunlight through your window. You are not too old. You are just one small ritual away from feeling strong, clear, and in control again. Your body remembers. Now let us remind it. We do not do this to chase youth. We do this to protect freedom. The freedom to walk unassisted, to stand tall, to play with grandkids, to say yes to life. Not maybe later. These 3 minutes in the morning are not just about circulation. They are about confidence, about taking back something aging tries to steal, which is control. So, here is what I invite you to do tonight. Place a small note by your bed. Write 3 minutes for my arteries. Tomorrow morning, before your feet touch the floor, do the 3 steps just once. And if you feel even 1% better, tell us in the comments below. Right? I started today. That is all. Just 3 words. Because when one of us starts, we all rise together. We are not just aging. We are aging smarter. And that makes all the difference.